Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the fourth video of repeat revision course of endodontics, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about pulpal pathologies like reversible pulpitis, irreversible pulpitis, pulpal necrosis, and we will start from normal pulp. And in next video, after this video, we will discuss about periapical disease or periapical condition, in which we will discuss about apical periodontitis, acute apical abscess, chronic apical abscess, and condensing osteitis. Now, in pulpal pathologies, we will discuss about first about normal pulp, then about reversible pulpitis, then irreversible pulpitis, then necrotic pulp, and at the end we will summarize this whole topic in this table with symptoms, treatment. Now first we start from normal pulp. Now what is normal pulp? Normal pulp is symptoms free as reported by the patient. Mean there will be no symptoms to patient like pain, swelling. Second, response to cold testing and effect lasts only for 1 to 2 seconds, then disappear. Mean when we applied cold on the teeth, like in cold testing we applied the ice piece, there will be a response, there will be pain, there will be response, but effect lasts only for 1 to 2 seconds, then disappear. Next is the response normally to electric pulp testing. In electric pulp testing, we apply current, and normal pulp show normal response to electric pulp testing. When we take a radiograph, periapical radiograph, radiographically show normal PDL space and intact lamina dura, mean the alveolar socket lining, which is lamina dura. This is about normal pulp. Mean no symptoms, response to cold test, response normal to electric pulp test, and radiographically show normal PDL space and intact lamina dura. Now come to the reversible pulpitis. In reversible pulpitis, we will discuss about symptoms of reversible pulpitis, test, and radiograph. In symptoms, there will be discomfort or pain or on sweet or cold food and beverages. When patient takes sweet, cold food and beverages, there will be discomfort or pain. Now it lasts for few seconds, then relieved. The pain lasts for few seconds, then relieve. Pain never spontaneous, mean pain never be starts spontaneously. This is the symptoms of reversible pulpitis. And this pulpitis we can reverse by giving a filling, and below filling there is a base or liner. Now in test, the cold test responds positively to cold test, mean reversible pulpitis we diagnose by cold test, and irreversible we diagnose by heat test, because reversible pulpitis give more response to cold test, response positively to cold test, and this test is enough for diagnosis. Now next is electric pulp test, they respond positively. In the radiograph, there is a intact lamina dura, no PDL space, and normal periapical area. Next come to the irreversible pulpitis. Symptoms, test, radiograph. In symptoms, the pain will be spontaneous pain. It will be start itself. The pain will be spontaneous and sharp pain, last for minutes or hours, poorly localized because it is a repeated pain, and interfere with the patient's sleep, and aggravated by hot, relieved by cold. Remember, aggravated by hot, relieved by cold. Therefore, in in swelling, in abscess, when patient apply heat, in result the swelling is increased. Why? Because it is aggravated by hot increase the blood supply, mean increase the cause vasodilation and increase the blood flow to that area. Therefore it is aggravated by hot and reduced by cold. And when patient take over the counter analgesic, it is ineffective to relieve pain. In test, there is a heat test response positively in a per diagnosis. Mean per cold test, per reversible purpose, per diagnosis cold test is enough, but per irreversible heat test is enough. And cavity test, if open carries response positively. In cavity test, we make a cavity with the help of burr, and if a patient feel pain, there will be pulpitis. If there is no pain, there will be pulpal necrosis, because the blood supply is compromised and pulp is dead in pulp necrosis. In radiograph, slightly widening apical space. Periapical radiolucency present only if infection has passed the apical foramen. If infection passed the apical foramen, then there will be periapical radiolucency and slightly widening of pedial space. Now in normal pulp, no widening of pedial space. In reversible pulpitis, no widening of pedial space. But in irreversible pulpitis, there is a slight widening of pedial space. Next is the necrotic pulp. What are the symptoms? Test and radiograph. In symptoms, in necrotic pulp is a asymptomatic. History of pulpitis or trauma. Patient have history of pulpitis or trauma in the past. Due to this history or the pulpitis or trauma, the pulp is become necrotized, and in necrosis the pulp is asymptomatic. Next symptoms is discoloration of teeth may present in pulpal necrosis. Now come to the test. It responds negatively to thermal and electric pulp test because the innervation is compromised. Responds positively to percussion or palpation if only apical infection present. If apical infection present, then it responds to percussion or palpation. Now come to the radiograph. Intact lamina dura, slightly widening apical space. Periapical radiolucency present only if infection has passed the apical foramen. Now come to this table. In this table there is a pulpal diagnosis, symptoms, test and treatment. First is the normal pulp symptoms. They are asymptomatic. Pulp test, moderate response to electric pulp test, response subside upon removal of stimulus, sharp response to cold test but disappear upon removal of stimulus. In the radiograph, there is an intact lamina dura, no resorption, no calcification or pulp abnormality. Treatment, no treatment needed because it is a normal condition. Now come to the reversible pulpitis. In symptoms, there will be sharp pain. They stop upon removal of stimulus. When we remove stimulus, the pain will be stopped. Stimulus may be hot, cold and sweet. Pain can only be localized with cold stimulus because reversible pulpitis we diagnose by cold test. A history of recent dental treatment, cervical erosion and abrasion will be there. Next is in pulp test, there will be electric pulp test and heat test is normal. Cold test, exaggerated response that diminish with the removal of stimulus. When you apply cold, the pain will be increased. When we but to heat and electric pulp test, its response is normal. But when we remove the cold stimulus, the response diminished. Percussion, on percussion there is no pain. In radiograph, caries are restoration without any underlying base. There will be caries or restoration, but there will be no underlying base. And normal periapical area and pedial width. Treatment, remove caries, adjust occlusion, apply appropriate base under the restoration. Mean for reversible pulpitis, we give filling, mean restoration. Next is the irreversible pulpitis. In irreversible pulpitis, the symptoms is spontaneous intense pain. Pain does not subside upon the removal of stimulus. Pain at night. Pain localized with hot stimulus. And like in the reversible, pain localized with cold stimulus, but here pain localized with hot stimulus. Repaired pain is seen. Patient say, I have pain in the temporal area, in the frontal area, in the everywhere in the face the pain radiate. And the history will be deep caries, trauma, large restoration. In pulp test, electric pulp test is elevated. Heat test, on heat test there will be acute pain. On cold test, exaggerated response that linger for only 30 seconds even after removal of stimulus. Percussion, if PDL is involved, there will be tender to percussion. In the radiograph, caries, there will be caries, defective restoration, might have PDL widening. Next is the necrotic pulp. In necrotic pulp, the symptoms is if dry necrosis, no tissue element in the pulp space. In liquefactive necrosis, pulpal tissue but without vascular element, more likely to cause symptoms and less likely to cause periapical pathosis. In pulp test, electric pulp test, cold test, heat test, no response because there is no innervation in necrotic pulp. In the radiograph, there will be large caries, large restoration, PDL widening, and periapical redundancy might be present. In this case, tooth might be tender to percussion. Now, in irreversible pulpitis, the treatment is pulpotomy or pulpectomy, means root canal treatment. In necrotic, pulp root canal treatment. In treatment in normal there is no treatment needed. In reversible pulpitis, filling. In irreversible pulpitis, RCT. In necrotic pulp, again RCT, root canal treatment. Now this is all about today's lecture, pulpal pathologies. After this video we will discuss about periapical pathologies. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. And there are more than 530 videos present on my YouTube channel, and every subject repeat revision course are present in a sequence for NLE, BDS, MDS and NBDA. You can go to watch these all video in a playlist section of each subject. For watching my videos, I am very thankful to you. Thank you very much.